The problem with Alzheimer's disease now is that when someone has a diagnosis of Alzheimer's disease, there's already a lot of damage that's been done in the brain. And getting those brain cells back is virtually impossible. So once damage has been done, it's very difficult to reverse that damage and to replace the function that's been lost. So the goal for us is really to find an early marker of disease that we can then use to predict who's going to go on to get the disease, so we can treat people early to prevent any type of cognitive decline or memory loss. The beauty of what we do is we have a window into the brain that very few people have. We can see things in the brain without opening the skull, without doing surgery. We can see, the structure of the brain, which is what everybody thinks about when they think about MRI. But the MRI scanner is such a versatile instrument. We can see how the metabolism of the brain is affected in disease. We can see how the function of the brain changes, and we can see how the connections within the brain and how the brain is connected to spinal cord and different parts of the brain, how that's changed or affected in disease. These are very sensitive measures. But even with all of those things, the brain is such a complicated organ. We really don't understand much about, the fundamental disease processes that are occurring in many neurological conditions. It's an incredibly challenging area to be working in, and an incredibly complicated area. And that's why collaboration, is such an important factor in this type of research.